So this is important to know. Closing is everything. So if you guys have a background in sales, or if you don't, I'm sharing with you guys the most important part. Closing is everything, okay? When we talk about closing, that's literally talking about closing the deal, all right? Just like, let's say you're closing a real estate deal, right? It's not sealed until you have the delivery of the house. You have the delivery of your condo, okay? So that's why it's very much everything as well in marketing your home health agency. I know so many home health agencies out there and so many marketers out there who are great and amazing at presenting, but don't even ask for the close, or don't even know how to ask for the close, or don't have techniques, or maybe just has one or two lines that they know to close the deals, to be able to get those referrals for them. And that is why they're not getting referrals, because they are not good closers, or they don't ask for that referral. You go in, do the presentation, go ahead with it, and then all of a sudden, you wait till the end and ask them, well, can we get a referral? Or sometimes, for those people that wait to the end to ask, they forget to ask, or they get gun shy and forget to pull the trigger, or don't want to pull the trigger because they might offend the person. You don't have to ask for the referral straight out. There's ways to say it nonchalantly, subliminally. All right? So, and that's what our goal here is, to be able to share that with you guys. Have you guys ever heard the sales term of ABC? It's actually known in the book Death of a Salesman, where they talk about ABCs and the importance of that when you are trying to get business. And ABC means always be closing. Meaning, don't wait to the end to ask for the close. Do it throughout. And we actually have a 2.5 hour presentation about closing the sale, where we literally share with you guys 40 to 44 closing techniques and specialties that you should actually know and learn. And if you want to be able to know about the closing techniques, we also have a second set of 100 scripts. 100 scripts that you can use on your marketing presentations. And you should have a minimum of 5 to 10 scripts or closing techniques within a presentation. Don't just use one or two. You have to have at least 5 or 10 to add in your presentation to do that, to make it even better. Now, if you want to have that 2.5 hour seminar, go to our website. We have it there. It's for $199. I know it's a lot of money that you guys are thinking of. $199. Oh my God, that's a lot of money, Michael. It is a lot of money. But guess what, guys? It's worth it because it's already approved scripts, and it's been proven also that it works, and you can learn so many different techniques from it. Okay? So closing is everything. But I'm going to share with you guys some closing aspects, some closing training that you guys need to be able to learn as well. And my goal is to make sure you guys know that closing is everything about marketing. Very much so important, and you should always know that, okay? Now, here are 8 items that prevent a person from asking to close. Okay? Just quick 8 items, all right? Now, number 1 is not there because we already discussed it in the previous slide, but we'll go back on it again before this slide is over. So, look, number 2, not liking to deal with emotions. People are scared of their own emotions, and by them asking for that sale, they get nervous. And you need to go past that nervousness. Look, you're already in front of the physician. Go ahead and ask for the close. You're in front of that administrator. Go ahead and do the close. Okay? Let me ask you this question. Before we make this decision right now, between 1 to 10, what would make you want to start referring patients to me? If they give you a 5, well, great. What can we do to make it a 7? Or what can we do to make it an 8? By asking that quick closing technique, and that's one of our closing techniques, they're going to tell you what's important to them. And then you can then reassure them why you're an 8. You can tell them what you do and what's going to be able to calm them down because they're worried, and that's why they gave you a 5. because they feel that you haven't fully explained to them. The reason why people don't choose you after you've done a great presentation is because they are just not knowing you yet or trusting you yet. And you need to find out what will make them want to trust you, okay? Number 3, you're not sold on your home health agency. Even you yourself don't believe your agency is a good product. I've even heard people say, I would not even refer my mom to this agency. But yet you're willing to work for that agency? Look, if you're not sold on your home health agency, you need to be able to talk to your team and find out what you guys can do to make sure that you will be sold, that your company is a good company. Because if you don't believe in the product, it is hard to project to people to want to use your services if you yourself don't believe it, because it's going to show them. I've seen a physician ask a marketer, would you refer your mom to your home health agency? And this marketer literally paused for a few seconds to answer the physician, and the physician said, you know what, that's all I need to know. And guess what? They didn't get a referral. So if you're not sold with your home health agency, get sold now, or develop products that will sell you so that you can sell it better. And then also, incorrect estimate of effort. What do we mean by incorrect estimation of effort? Sometimes people think that one visit is good enough. Remember those statistics in the beginning? That it takes 5 to 12 visits before you can even get a sale or get a referral. So they think that by them just doing a mailer of postcards to the mail that they're going to get referrals. They think that by them just having a website, they're going to increase their referrals. No, it's how you use your website. There's techniques that we teach you guys on how to be able to use your websites correctly. Those are the advanced techniques that we have. So incorrect estimation of effort is big and why you're not going to be successful. So you need to be able to have a detailed plan of follow-ups. We literally teach a 20 follow-up system for people. It used to be 12. We now teach a 20 follow-up system. So the moment that you visited a referral source the first time, you need to follow up with them 20 times in different ways within 40 days. Within 40 days. Okay? Next thing is this, is you need to be reasonable. You need to be reasonable with yourself and what your goals you can have. But whatever you yourself determines your goal is, you need to double that, triple that. Because if, once again, like I said, if you reach for the stars, you'll hit the moon. But never, if you try to hit the moon, you may get stuck somewhere in the middle or not even get launched at all. So have a high goal. Set your standards high. Some of the most successful people will tell you that, and you'll see that everywhere. I made my goals so high that even I could not reach it. Even myself, there's goals that I have written down that even I get shocked myself on why I wrote it down, because that's not possible. But only my actions will determine if it's possible or not. But I'm going to try. And that's why I will always write certain goals, even though it may seem unattainable, because you'll be surprised how you can succeed on something. Now, 6, handling objections. Okay? You need to handle objections that are only complaints. All right? People are going to be complaining sometimes. People are going to give you objections. And the typical objections you have is against time, against money, against, so many basic simple things that we're going to show you guys how to get past that. Another thing is shortage of closing materials. What do you have in your arsenal that you can use to close them, to close the deal? Not just your brochures, not just your business cards. Do you have literally something to give them 20 times? Some educational based marketing material that you can deliver to them 20 times in 40 days. Or for now, in the beginning, I'll teach you your 12-step follow-up program. That if you can start developing your 12-step follow-up program and you can master that, then you can increase to 20 to increase your chances even more. Because remember, like I said, 5 to 12 contacts increases the chances of you getting a sale or referral. So that's why we have that 12-point follow-up formula, because it may take 12 follow-ups before we get a yes. So what we did is we made it a 20 now so that we increase it even more. Because look, we're willing to follow up a referral source 20 times in 40 days. Most agencies will only visit them once and never come back. And then people that will visit the referral source twice becomes lesser and lesser. So if we follow up the physician 20 times, guess who's going to possibly win? And that's what I want to teach you guys, is a 20-step follow-up program. Last is the wrong person. Did you qualify the person in front of you? Are you talking to the decision maker? Are you talking to a potential referral source that does have Medicare patients, that does have home health patients, that does have home care patients? Okay? Are you going to go to a pediatric doctor if you're looking for geriatric patients? No. Of course not. Are you going to go to an OBGYN? Are you going to go to a long-term care facility, or are you going to go to a skilled nursing facility that has Medicare patients that's going to be discharged to home? Because if it's a long-term care, they're going to be there for long periods of time. They're not leaving the nursing home, okay? So you need to be able to know how to follow up, but at the same time as when you're marketing out there, you have the right person in front of you. So that's very important, and that is what's preventing a lot of people from closing. And number one, of course, is never attempted to close at all, meaning that either you wait till the last minute or you don't even ask for a referral. Here's a quick technique that I have. It's called a referral close. Doctor, before we even start this presentation, because I know I absolutely will share with you some amazing information that you will be able to use, what I would like to ask is this. Before I start this presentation, can you tell me, are there any other physicians that you know that would possibly need our services, that would enjoy the fact that they have a great company to work with? Ask that quick question right there. It's called a referral close. Before you start a presentation, what's going to happen is this. The doctor is going to say yes or no. If the doctor says yes, well, doctor, who's the doctor that you want to refer to us? He's going to give you the name. Do you have their cell phone? Do you have their information that we can go there? So now you get a referral. So now you have another person you can visit after you're done with this physician. You can then say, if they refer to a Dr. Kim, for example, Dr. Kim, Dr. Cruz over there referred me to you. He said that you would love our services. He said that you would know and enjoy the fact that you're going to work with a great home health agency like ours. Okay? And now you had a referral close. Okay? Somebody referred you as well. So look, and that's one of our closing techniques that we have. You want to ask for referrals constantly. Other than a patient referral, a referral to another provider that can refer patients to you is also good. People hang out with the same people that you want. Okay? So look, you're just going to fail on closing if you have 8 of these. And if you know how to go past 8 of these, from never attempting a close to not liking to deal with emotions, not sold on your home health services, you have the incorrect amount of effort, you're not reasonable, you don't know how to handle objections, okay? You don't have enough closing material, educational-based marketing material items, and you're talking to the wrong person. These 8 things, any of these shows up, you're not going to get a referral at all. So you need to be able to learn how to go past these things easily, okay?